Hi everyone, my name is Liz with Collectiv, and today we are going to talk about 6 ways that healthcare organizations can use Power Platform. Healthcare as an industry struggles with inefficiency. There was a study done on high-income countries, and the US ranked last in terms of healthcare efficiency. About 15 to 30% of healthcare costs are administrative, and half of those costs don't even directly impact patient care. But luckily, the Microsoft Power Platform is great for helping with inefficiency. A brief note before I get into my demo, all of the data in my demonstrations is fake data for demo purposes only, but the Microsoft Power Platform is HIPAA compliant, so it's a secure way to share data across your organization. The first Power BI dashboard I have pulled up here was designed with a hospital unit in mind, and you can see I have a few different visuals here that show work RVUs in patients by performing provider and also by day, and I have all of our data here broken down into a financial class pie chart. And then over here, I have a couple different cards. So all of this data can be sliced using our slicers on the left-hand side here. If we wanted to see this for a specific physician, we could go over here, filter for Dr. Smith, and we can do the same for date, for patient gender, or for financial class. Or if we want to look at only our pediatric population, we can use this age slicer to filter by age. All of these visuals can also filter each other. So let's say I want to get a better look at our Medicare population. I can click on that segment, and now all the other visuals will be filtered for only the Medicare population. You can also see which portion of their patients and work RVUs are related to that segment of the patient population. So instead of looking at work RVUs by day, we can look at work RVUs per specific hour each physician worked. I'm going to go to the data tab. You can see I have one data source in my dashboard. Based off of date, you can determine how many hours each of the physicians on this tab worked. So even broken down further than day, you can break it down by each individual hour. And then of course roll up to different levels. So even though I've only used one data source for this dashboard, you can add in many different data sources to provide even more value. Let's say we want to distribute this to the group of physicians, but maybe we don't want them to see everyone else's data, we only want them to be able to see their own. So we can do that with something called row-level security. I'm gonna go to View As, and now when I click on Physician View, this will filter to only show my data. How many work RVUs I generated, and how many patients I saw, and the payer mix, but I cannot see this for anyone else. It's only for me. And it's a great way to communicate data like this across all your staff without them seeing each other's data. So let's say we want to refer patients to the orthopedic office. Let's enter the patient's name. We'll enter their phone number for a reason, broken arm. And performing provider, I'm just going to enter my name, click submit referral, and it's going to show up on our referral list to the right. There we go. So now let's say I work in the orthopedic office and I'm going to schedule a follow-up appointment for this patient. You can see it's in progress now, so I just click on this arrow. I scheduled them an appointment for next Tuesday. The provider's with a demo provider, and then you'll see it is now complete. So this is a great way to refer patients to different units in your health system or to PCP offices or any other way that would formally rely on faxing or phone calls. So let's say I have this training PowerPoint presentation and I want to make sure that all the staff in our office review it and compile all those reviews into a list that can be easily accessed for compliance purposes. So here's the same PowerPoint from before, but I have made each slide its own screen so we can easily navigate through our slides. So I am going to click this button. Now, Power Apps has stored that I've completed the training in this Dataverse list. We get an easy list recording who has completed the training, and you can bring it out if you ever need to for compliance purposes. Now let's say we want to notify each individual's manager when their training is complete. Up here in our Dataverse action, we say that when training is completed, send an email notification to the user's manager. So you don't have to go through and monitor this list. They can just get an automatic email whenever their user completes the training. And for healthcare, that could be at midnight, so it's very nice to get it right away. Thank you so much for watching. Remember to like and subscribe, and if you have any questions about anything in this video, please feel free to leave us a comment. Visit GoCollectiv.com to learn more about how we can help your healthcare organization leverage Power Platform.